for us. And I would also like to use the opportunity to appeal to Nigerians. Because at the end of the day...
The Nigerians of the NARD?
You know, including Nigerians, whether as minister or as NARD or as NMA, the whole essence is to serve the Nigerian people. Okay? Let us look at these issues dispassionately. Okay. First, it is not correct that we have abandoned all the agreements and nothing is being done about it. I think we have been able to establish that here today. We are making movements. Yesterday, they still met with the Minister of Labour, with the ministry in attendance, and discussions are ongoing in each of these cases. Doctors that have been terminated, we have agreed that they should be reinstated. So if the issue is about whether it should be in Lokoja or not Lokoja, it's a matter of discussion. All right.
Well, we see if the NARD members will heed to that appeal. I guess time will tell on Monday particularly. But as you may have also seen there, Dr. Agbo Ibuta joins us today. He's a medical practitioner. Good morning. Thank you for coming on today.
Good morning, Chamberlain. Thank you for having me.
So, here we are again talking about another potential strike by the resident doctors on Monday. Well, you being a doctor yourself, what do you think of this?
Well, the context is very clear. The last strike lasted maybe 4 weeks thereabout, from the start to the 29th of November. And at the end of that, there was an MOU. Between that time and now, we probably have, it's just been about 4 weeks before the first salvo and warning about the strike was to come up. But you need to understand that the period that was given for some of the interventions to be put in place fell within a festive period, fell within a time where you need to bring certain parties together. The SGF, the government side, the committees, and all of those things. And this is the time when the wheel of government slows down a bit. So it would have been fairer to elasticize that time and to allow sufficient time and engage.
How much time, for instance?
Well, enough time to allow for some of the basic things to, because they are basically...
How much time is enough time?
Enough time to allow to prevent a situation where 12,000 doctors, 40% of the doctor workforce of this country would down tools, and 70% of out-of-pocket payments would immediately jump to 95% when fellow Nigerians would suddenly experience a situation where their expenditure on health would double or triple or quadruple, would go from 100% increase to as much as 1,000% increase, where there's a background context where Johesu is already on strike, so completely crippling. We are a country of 240 million people. Our current human resource in terms of doctors are just about 55,000. Based on the WHO recommendation, we should be looking at 1 to 600. That should be, we need 400,000 doctors. So we basically just have 13.5% of the doctors we need. We are in deficit of almost 87%. Now, when you look at the metrics again, there are states in this country that have a ratio of 1 doctor to 48,000. They're already struggling. So in as much as we need to advocate, we should also do that within the context of how much lives do we want to sacrifice.
Let me ask you again, how much time would you say is enough time?
Enough time to address the key issues. And the key issues are basically...
Yeah, before the key issues, I mean, how much time?
Okay, let me put it like this.
Yeah.
The challenge with the Lokoja 5, doctors who are supposed to, 2 of them were terminated, 2 were reprimanded, and the 5th one did not have the opportunity to be heard. That matter was resolved from the point of view of the government and the key players. But at the end of the day, there was an impasse. And NARD has said, no, we don't want them to just be reinstated. We want them to be reinstated to their previous organization, which is federal.
Before we go a little further on that particular matter, I'll ask you how much time, because in the MOU, they agreed to implement these recommendations within 2 weeks. They both signed the MOU. So that's why I'm asking, how much time was that? If there was going to be a challenge, they wouldn't have agreed for 2 weeks.
Absolutely. But we can ask the question and we can dwell on that. But when you see that you are unable to meet the MOU, the terms of the MOU, you should engage in good faith. You should not put the lives and blood on the table. At the end of the day...
Who should engage? Government engage any...
Everybody. Everybody, because at the end of the day, is the Nigerians, the people out there, our siblings, our relatives, ourselves who would suffer to a large extent. Because if you go to a public hospital and you pay 1,000, 5,000 naira to see a doctor, during this period, you would go to a private hospital, that number would completely go up. So one is not saying that NARD must agitate. They should agitate. It's within their right. It's within their purview. But to a large extent, they should do it with some level of human face. They should do it with some level of understanding of the dynamics of how the wheel of government rolls.
What actions exactly would you want to see to say, yes, this is with the human face?
For example, with respect to the increase in the professional allowances, which was resolved in the last quarter of last year, that intervention by government, the other side, increased remunerations as much as 45% in terms of special professional allowances. That immediately increased the expenditures on the spot, the last quarter, 90 billion. That, from all indication, has been passed on to the finance. The budget office is working on it. We know how FAC allocations come. They come a bit and lag. And by the time they come, you need to go to the cash office, you need to raise the money, and you need to put it out there. Are there ways to shorten that circle? It is possible. But at the end of the day, we must understand that we cannot say that 2 weeks, yes, could have been possible. But things come up. What if we had a major disaster? What if there were some other challenges that did not make it...
That's been hypothetical, but has that been the case? If that were the case, why hasn't government communicated to the NARD?
Are you sure they have not communicated?
The NARD says we haven't. That's why they're putting up a notice to strike.
To a large extent, I believe that they have been under the table discussions.
No, but that's not what the NARD told us when they were here.
No, they have been under the table discussions.
You consider that for sure.
But the challenge, I mean, the data we have suggests that. Because these are human beings, these are people, we are all together. We all are out there trying to make sure that the common man on the street, morbidity and mortality ratios drop, and the common man sees a new day.
You know the reason why those gentlemen their appointments were terminated in Lokoja?
Well, the data, the information is very clear.
Which is?
They are mainly union officers. And in the course of probably certain activities, there may have been some infractions. But within the structure of the civil service, the senior staff committee on disciplines actually sat and came up with a resolution and terminated the appointment of 2 of those doctors.
Because they condemned the activities of some of the management staff.
Now, the challenge with that is that a lot of water has gone under the bridge, and to a large extent, a committee that was set up by a wing of the government, the Federal Ministry of Health and all of that, has resolved the matter and has said, you know what, let's do it like that.
Say that has not been resolved.
Okay, so they have proposed a resolution, which is, look, out of the 5, 2 of them will just be reprimanded. They should go back to work. The other 2,
that's something from, because
the other 2 who were terminated,
sent us,
yes,
said that contrary to what the minister told us, he said, well, the appointments were not terminated. They only told them, okay, some of you come back, others go. But they sent us, NARD eventually sent us letters saying they actually terminated their appointments.
Okay, no, the appointments were terminated in 2004 for one person and 2005 for a second person. But that has been reversed to a large extent. There may be challenges with communication and all of that, but that has been reversed. And what the advisory said was that 2 out of the 5 will need to be in a new facility, not Lokoja. No, now that is the bone of contention. Another 2 who was basically reprimanded have been reinstated. They only need to write a letter of undertaking. And the last one, who is a 5th person, who was not available for the process, the disciplinary process, it's been said that the person has to be heard And it's a fait accompli that at the end of that, the person will be reinstated, likely with a reprimand and a write-off.
If I understand you properly,
yes,
you're coming across as though you think the federal government is doing the best they can in handling this matter, and that NARD should be, quote unquote, understanding and give them more time.
To a large extent, the challenge is that people will die. So we can agitate, we can mount pressure, we could be very out of the box, innovative and strategic about it, but to a large extent, we should limit the casualties, cut down on the mortalities, and not worsen our numbers in the process of agitating.
All right, let's go to break. We'll be back in just a moment. Don't go away.
Thank you for staying with us. Well, Dr. Ebuta, just one quick question from me. You are probably aware of that data from the presidency that there's been a 96% plunge in medical tourism spending, a figure healthcare experts, some healthcare experts are saying it is not true. But they affirm that with sustained investment in public hospitals, expanding private sector capacity and reforms already underway, the country could begin to see a measurable and lasting decline in outbound medical travel within the next few years. So there are those who are wondering whether or not the NARD is aware that you're already contributing to, reducing outward, medical tourism away from Nigeria, and that this strike would reverse the gains that you all have made over the short time we have.
Yes, I'm aware of the data, and there's also another data from the CBN that says that, or that confirms that there's been a 52% drop in the demand for Forex that is related to medical expenses for medical tourism abroad. You are spot on. I mean, you have highlighted the key points, and it is true. It will not only reverse some of the gains, it would also endanger 216 million out of the 240 million Nigerians who access care within the public service space, within the public space, and who pay for, or who would now be forced to pay for services from out-of-pocket expenditure, increasing their daily expenditure of in health from as much as 100% to 10,000 or 1,000%, depending on your diagnosis. And so it's a very critical issue. We may lose more than we will gain. We will continue to go through these cycles. Okay. And to a large extent, the present team that is trying to sort this out has come up with a very innovative intervention called the collective bargaining. Because in the past, you would have different groups. JOHESO would come up and have a challenge and would go on strike. And a different group, the NMA, would go on strike, and NARD would go on strike. Now, the collective bargaining strategy has brought all the players, the nurses, the JOHESO, non-medical doctors, health workers, and all the medical doctors on the same table to agree so that whatever you're giving to A, B agrees that you should give to A, and whatever you're giving to C, A agrees that you should give to C. Now, that process requires multiple players, say, Salary and Wages Commission, the Accountant General Office, the head of the Civil Service, chaired by the Secretary of Government and other organizations like the NMA, JOHESO, and the Nurses Association. Now, this cannot happen automatically. Obviously, you have the Federal Ministry of Health as a chief conciliator trying to resolve some of these issues.
Speaking about that, let's wind down with this. Yes. Are you aware? The NARD says, they told us that they wrote the Ministry of Health December 17, reminded them of the MOU. This is besides the meetings, the several visits they've had.
Yes.
There was no reply, no communication from the ministry to the NARD. What were they supposed to do in that case?
The truth about it is that we do understand how government works.
Should we tolerate that? Shouldn't they work better?
I mean, we must insist that government must work better. We must insist that the wheels of government will turn faster. But to a large extent, when you look at the background on all of this, 19 demands, 10 have been acceded to. There's a 50% accedment rate. The remaining 9 of the demands has to do with the fine details. The payment of a rise of 45%, 90 billion naira, an increase in the number of or a harmonization of guidelines for engagement of local officers, a correction of the challenges with skipping that has happened
the NARD
to a large extent.
Disagree. They say they had to condense all of those demands into about 8 or 9, and so not that they met a lot of all those other ones, but unfortunately we're out of time on this one. Dr. Agbo Ebuta is a medical doctor. Thank you for your time this morning.
Absolutely a pleasure. Thank you for having me.